This photo here says almost everything you need to know about the Ebola virus, but I'll get to that in a second. With the current Ebola crisis in the DRC, the issues are starting well before the doctors can even begin to treat it. Here's my colleague in the DRC explaining a little bit more.
Et cela est dû plus à la résistance communautaire et qui handicape le déploiement rapide des équipes, où on dénote aussi certaines attaques des CTE et qui est un grand risque aussi pour le déploiement des humanitaires.
So what he's referring to here are instances of people throwing stones and damaging facilities where Ebola patients are being treated. During a previous outbreak, a clinic was actually burned down. Now, a response like this might seem extremely shocking and a little confusing, to be honest. But when you dig a little deeper into the situation, you begin to understand how complicated things are here. You see, as in many parts of the world, burial traditions in this region are specific and of great importance. However, because Ebola can actually spread more easily from a deceased person, any burial practices like this can put everyone at risk of catching the virus and perhaps dying themselves. So a burial needs to look more like this. This is a casket of a 6-month-old child who died from the disease. And I know this is difficult to look at, but I actually want to spend a second unpacking this photo because it says a lot about the current crisis. Closest to the casket, you have the protected medical professionals. Then a little further away, we have the priest. And then further beyond that, we have the grieving family. Now, obviously, nobody wants their funeral to look like this, but this is the reality for people in the country dealing with this crisis. Unfortunately, the problems here are more than ceremonial. You see, the population in this region has a general mistrust of medical facilities, and this is due to the decades of poor health outcomes in the region. You see, rural DRC has been suffering from a lack of funding for decades, and this means that they don't have what they need to solve even routine health problems that come up. This year alone, they have only received 30% of the funding they need to operate. Then you add on top of that the years of armed conflict, and then the difficult geography of this region. All of this compounds to mean that supplies and staff just cannot move around easily in this country to meet the medical needs. Lastly, you have a country that is actually growing at 3 times the global average and is actually one of the youngest populations on Earth. What does this mean? What you have is a health structure that was already barely able to keep up with the stable population, let alone a quickly growing one. And that is without a deadly virus spreading. This current Ebola outbreak is already the second most deaths, and it's the fastest growing of any of the previous outbreaks. The fatality rate of this virus can be as high as 50%. All of this means an overwhelming challenge for any healthcare system in the world. But this one is happening in one that has faced more challenges than perhaps, honestly, any other in the world. And when you have a situation as complex as this, the mistrust and misinformation can grow easily. In this case, what mistrust means is that when somebody gets sick, they don't report it. Or it means a family member doesn't listen to the medical expert and chooses to bury their loved one in an unsafe manner. And sometimes it means attacking the very clinics trying to help, because to some, they're a place that took their loved ones and wouldn't let them say goodbye. And this is why World Vision not only works with frontline clinics, but it also focuses efforts on training and educating the population so that the root problem of mistrust can be minimized. And this isn't the first time that World Vision has done this. During the 2014 West Africa outbreak, this is the one you probably remember. It was the largest Ebola epidemic in history.
For the survivors they're facing lots of problems, like stigmatization. The families and they disown we, the communities, they discriminate we, they know they near we, then they afraid we say, we are Ebola people there.
World Vision's faith background gave it something that other organizations didn't have: an existing relationship with religious leaders that communities already trusted. So staff trained more than 2,000 influential local leaders to deliver the accurate message of Ebola awareness and prevention. 2,117 faith leaders were trained to conduct safe and dignified burials, and not one of the 58,000 World Vision sponsored children in Sierra Leone contracted Ebola. Now we are bringing this approach to the current outbreak. World Vision has reached more than 400,000 individuals through door-to-door and mass education campaigns. But as I said earlier, the funding here is just not enough to reach these remote and yet populated places. With more support, we can continue building the trust in these communities, which in this case may be the best chance at stopping this virus.